how we architect those experiences in that pre-touch moment will be phenomenally important. The beauty is, though, that in that open social environment, we're also able to tap in using ethnography to understand what patients hate and what patients love. We can even discover what's working and what's not working. We all know the power of patients like me and other types of specific and disease-specific hyper-influencing social networks. So the way in which we architect our relevance in those pre-touch moments will have a tremendous impact, and it also is tremendously fertile ground for innovation. Those first touch points and how we architect those in clinics and hospitals will, of course, also be incredibly important. Now, the way in which we're going to use and leverage the digital grid, as I see in terms of improving states of care, we know, for an example, as an innovation management consultant, I can tell you that we can get 50, 60, 70% better returns on strategic initiatives just through collaboration, just through gamification and connectivity.
Understand this space, and I can tell you that in the next 3 to 5 years, many of the clinical models, the distribution models, the sales models, the business models will be destroyed. Some of the things that's pushing that, the silver tsunami. We're at the beginning of the silver tsunami where the baby boomers are going to consume the overwhelming majority of their health care in the last weeks, months, and years of their life. But then you combine that with the epidemiology of chronic disease. In healthcare in general, one of their strategic pillars is to develop a future casting activity. This is a range of the stuff. These are a range of what we know is going to happen in healthcare. When you take the medium of innovation in combination with the demographics of the changes, what does that likely mean to our business? And what patients love and what they hate. And how do we take those learnings and transmute those into experiences across that journey? How do we do it? Healthcare hacking is all about. We are going to destroy the clinical models that you've seen over the last 40 or 50 years. The way in which medical devices are distributed and collaborated with using game mechanics and socialization and hyperconnectivity. These elements, these various components, are really your future. And what I'd like to do today is to share with you a glimpse into some of the cool stuff that's going on right now and what that looks like as we go through what I call Wave 3. Which is really the tipping point of healthcare. Now, when you think about it, and I don't want to oversimplify it, but when you think about the first wave of healthcare, the first wave was really about how are we going to provide healthcare to everybody? And so the first wave was about who's going to pay for healthcare, wave 1. And that lasted for 40 or 50 years. It was a societal discussion. Meanwhile, we're building many, many interventions. We've doubled the amount of prescription medicines in that period of time easily. But at the same time, we're building more interventions, and we're asking the question, who's going to pay for health care? Well, I think the Affordable Health Care Act has sort of answered that question. So now we're entering into a very short period of time that I call Wave 2. And Wave 2 is the tipping point time. And this is where we begin to realize that all of the demographics of healthcare, in combination with the wherewithal of hackery and technology, is going to create the perfect storm, and that's what moves us into Wave 3. In Wave 3, the disruptive innovator and the hacker are going to own these spaces.